Everyone, this is my new YouTube channel, and here we are discussing about the vital signs. Vital signs are also known as circadian signs. Circadian means important signs. Our doctor owners are health professionals which are help for diagnosis and the treatment of the patient, and as well as the assess the health status. So vital sign is an important circadian sign which is helpful to assess the health status of the patient. The vital signs are temperature, pulse, respiration plus BP. These are the 5 cardiac signs. So other than that, SpO2 is also considered as one of the other vital signs as well as the pain. So temperature, the adult normal vital signs value, you should know that the temperature is 37 degrees Celsius orally, or in case of Fahrenheit 98.6 degrees Fahrenheit. Pulse 72 beats per minute, but the range is 60 to 100. Respiration 12 to 20 beats per minute, and BP is systolic and diastolic. Systolic should be less than 120 mm of Hg, and diastolic should be less than of 80 mm of Hg. So we usually tell like BP is less than 80, 120 by 80, or the BP is 110 by 70. So it should be mentioned always with the unit that, and the first one always is systolic and second verse is diastolic. Saturation should be less than or equal to 95%, but it will usually vary and observe equal 190 to 100%. That is considered to be normal. So moving to the next point, temperature. Now we will discuss each of the vital signs in detail. So this video can be a little long, but we should have the proper knowledge that what is the temperature, how many types of temperature, and what are the sites that we can measure temperature. So the temperature is the balance between the heat production, that is thermogenesis, and the loss, that is thermolysis. So lysis word always indicate breakdown in the body. There are two types of temperature, that is surface and core body temperature. The surface temperature that we measure taken from the surface, that is axilla. If the outer skin, fat tissue, or the subcutaneous tissue are in the direct contact of the climate or external surface, that will change the temperature of that surface. That is known as axillary temperature. But in case of like we have taken the temperature from the orally, so orally it's internal body temperature, or from the abdominal cavity, tympanic or temporal. These are the space or cavities which are deep tissue. So it will give the immediate and exact body temperature. So temperature is mainly controlled by hypothalamus. So hypothalamus is known as the temperature control center of the body, in which hypothalamus is also divided into two parts, anterior hypothalamus and posterior hypothalamus. Anterior hypothalamus is responsible for heat loss, that is thermolysis, and posterior hypothalamus is used and control heat production, that is thermogenesis. So tip to remember, production can be linked to posterior, that the P square, you can learn like P square, production and posterior. Hormones that increase body temperature are thyroxine, testosterone and progesterone. Testosterones are mainly responsible in male, and progesterones are mainly responsible in female. Body temperature usually lowest at 1 am and 4 am, and maximum is by 4 pm in the evening. This is an important point that can be asked in the competition. Pain is considered as the new fifth vital sign. So 4 are TPR plus BP, and the fifth one is pain. So heat loss can be done by 4 mechanisms: conduction, convection, evaporation and radiation. These are the questions which is mainly asked in NOSET, with like in newborns, what is the type of mechanism used in heat loss. So the newborn immediately are born trapped into the heat warmer, or they are always covered. So because their mechanism of heat loss is very fast due to the process conduction, convection and evaporation and radiation, because of less fatty tissue or subcutaneous tissue in newborn, as well as in the adults, it's also observed that these are mechanisms which are responsible. So conduction means that the directly contact with another surface, that is known in conduction. Transfer means that the heat is transferred from body to the surrounding air. That means fan. If a fan is there, so it will easily promote that the heat loss is more. Evaporation. Heat loss occurs when the liquid is converted to vapor, that is sweating. If I will sweat more, that means heat is lost in maximum amount from my body. And radiation is transfer of heat from one object to another without any physical touch, that the loss of heat in the cold temperature. Temperature normally varies. So according to the site of the body, the temperature varies. Like the oral cavity is having the temperature of 98.6 Fahrenheit. Rectally it is 99 Fahrenheit, which is 0.5 to 1 degree Fahrenheit higher than the oral temperature, because rectally there are more nerves. So large blood supply is present. So due to which we are always minus 1 degree temperature from there. And axillary, where is the more sweating and more fluids are present, more body moisture is present, that is there is 97.17 degree Fahrenheit temperature is present, lower than the oral temperature. So we have always kept in mind that the rectally we have to always -1 from the temperature we are taken, and orally axillary we have to always do the +1 in temperature that we take. So if there is an important short question that can be asked in the exams, basically in MCQ, in different university, because of the change pattern according to INC, that how to convert from Celsius to Fahrenheit and Fahrenheit to Celsius. This is a very small and short topic that we have to know. The formula is like, if we have temperature in Celsius, that is, this is the formula that you should know. If we have to change from Celsius to Fahrenheit, or in case of we have to change from Fahrenheit to Celsius, just do the opposite. Fahrenheit equal to -32 equal to so in case of we are having in Celsius, so we have to do F -32 opposite ले जाइए, and then 5/9. So this is the formula. You do practice some questions, but if you are having any doubt in simplest calculation or any confusion in the formula, you can ask in the comment section, then we will practice some more questions in next video. Thermometers. The thermometer is a simple instrument which is used to measure the temperature. We have seen different type of thermometers since childhood, like the mercury one, which is very hard to use. Means that is the mercury can is not easy to handle. Sometimes it's break down, sometimes it's not visible to us, and it's very hard to sterile. After each patient we have to sterile and clean with 3 different solutions. Some of you know from the basic fundamentals that the mercury thermometer is clean after use with 3 solutions. So these are the basic we should know. But different type of thermometers are used, like the mercury thermometer, electronic thermometer, and digital thermometer, most common one. Tympanic thermometers are used, which can be seen, but the most we have seen in common life, that is digital thermometer, as well as in the COVID we have seen disposable thermometers. In COVID time we have seen these forehead thermometers, which are used to take temperature from the forehead, as well as the tympanic. Strip thermometer are also available, which disposable one, that the patient only one time we can use. We have to put the strip into the oral root or mouth, and then remove the thermometer after 1 minute or 60 seconds. Method of measuring temperature. What are the sites of measuring temperature? So there are mainly 4 sites of measuring temperature, but 5th site is also available, but oral, rectal, axillary, tympanic, and forehead thermometer. These are the advantage and disadvantage. You can read, and any doubt you can ask, but the most safest is the oral Oral one is most safest one, and rectally it is also done in children to check the anal patency just after the birth in newborn assessment to check there is a anal patency is maintained or is there any abnormality after the birth. And tympanic is checking for the hearing aid, is there any wax deposition or impaction is present. And forehead thermometer is used for the persons who are having dirty hair, or means that it's not safe to touch in without to prevent any contamination. That is the point. The safest and accurate reading is considered as rectal thermometer reading, but it is not convenient to take an unpleasant as a patient experience, so we are not considering to take in maximum time. Body different sites are present, and the best site to assess temperature in children is axilla. These are the small points that are needed to be known, and these are should be remembered. Points to remember while taking temperature: we have to take, in case of oral temperature, it should be measured 20 to 30 minutes after taking hot and cold. So we have seen different movies and cartoons that the people are there drinking hot coffee and then taking temperature, because the hot coffee or hot milk increase the temperature for some moment, 2 or 5 minutes or 10 minutes of the oral cavity, and this will give errors in temperature measuring. We have to check the sublingual portraits if there is anything placed before, or we had any food is kept over there. In case of any before taking temperature, we have to clean the temperature, and this is an important question. Cleaning the thermometer before and after, how we will do it? Well, before taking temperature, we have to do from bulb to stem. That means like this is called bulb, this is called stem. So before taking temperature, we will clean how? Let's see. Well, always this is the principle of nursing foundation, that we will go from least contaminated area to most contaminated area. So before least to most. So this is the least and this is the most. So before taking temperature, clean the thermometer from bulb to stem. So we will clean like this. But after taking the temperature, just this is contaminated, obviously. This is kept in oral cavity or axilla, so it is contaminated. Now we will clean like this. So in case of opposite, someone clean like this, so what will happen? This contamination will lead to other parts of the thermometer, so it will spoil the thermometer. It will not clean it. So we have to always keep this common sense that before taking the temperature, we will clean bulb to stem, and after taking the temperature, we have to clean from stem to bulb. This is a very small question, and which is constantly asked in different exams. Glass thermometer is indicated in patients who are alert and cooperative, because it can break down the mouth, and in case of unconscious patient, which will cause harm to the patient. For taking rectal thermometer, patient need to be positioned in Sims position. While taking rectal temperature, insert thermometer 2.5 to 3.5 cm beyond anal sphincter. So anal sphincters are the sphincters present in the anal area, and we have to put beyond, means that it should enter. So these are the vital signs, the temperature, and we will discuss about next topic, that is respiration, pulse and BP in next video. And I hope if this is a little bit, we will improve also. Surely we will improve together. I will also improve in my different skills, explanation as well as editing. But this is a series I started to upload daily basis for my consistency, as well as to guide the juniors of different diploma or graduation, BSc related to nursing and A&M and GNM. And I think this is the basic, and the book I am referring is Target High. All my content will be considered with Target High, P.I. Yadav and different nursing books. And after completion of one or two topic, like we will complete the whole vital signs, we will do together the MCQ with explanations, which will help to revise the content that we learn, and also helpful for our competitive preparation as well as the university exam. If you little bit like of my video and any content and want more content, so please like and subscribe my channel, as well as do comment down below what are the topics that you urgently needed, or any type of notes or any guidance for any topic, to let me about it. Thank you everyone. Bye bye.